Hello everyone, you're welcome to this vaccination training. In this Module 8, I'll be taking us briefly on documentation and liability. Very briefly about myself, I'm a pharmacist with the Department of Clinical Pharmacy and Biopharmacy, University of Lagos, and it's my pleasure to be here with you today. So it's my expectation that at the end of this session you will be able to describe the information that should be included in documentation for vaccines and be able to discuss the use of immunization information systems as we have them in Nigeria, describe national reporting systems for adverse events and errors following immunization, explain the liability, risks and legal protections for authorized immunizers in Nigeria, explain how to implement reminder and recall systems for multi-dose vaccines, explain the purpose of standing orders and protocols in Nigeria, and describe the information that should be included in those kind of documents. For vaccine documentation, you usually would need to make your documentation into the repository that belongs to the federal government. It's organized in different steps and you fit in at the vaccination or facility level. There are about 3 levels of records. So for example, you create your records at your pharmacy and then you also submit a similar compilation of records to the DSNO, that's the Disease Surveillance and Notification Officer at the local government level. Most times you do these records and submit them at either the local government office or to the NPHCDA office in your local government. After those records are pulled together, they will be sent to the state primary healthcare board, from where that information, once it's been scrubbed, cleaned and approved, will go into the central repository at the national level. Now for immunization, there are 2 tracks for entry of documentation in Nigeria. First one is through the National Health Logistics Medicine Information System, and that information system is connected to something called the DHIS. The DHIS is the District Health Information System, and it's a free openware documentation system or database that is used by up to 73 countries around the world for pulling health information and analyzing health information digitally. Now, attached to the DHIS are other analytical softwares, but importantly, there is one for immunization, for routine immunization, and one for COVID-19 vaccination. And what it helps the government do is see on one simple screen all of the information that's important to take decisions or analyze decisions that have been taken at the lower rungs of the decision tree. So as soon as you make your documentation, you're meant to submit it to your local government or the NPHCDA office at your local government. Through that route, that's the patients that you have attended to, the information will be captured and recorded in the DHIS too. For pharmacies, when you attend to your patients, you will also have their vaccination cards in which you can make the records and sign off, that you were the one that administered that vaccine to them at that time. It is expected that vaccine records should include at a minimum the type of vaccine and the vaccine brand name, the date the vaccine was administered, the route of administration, and the site of administration. You should also be able to include information like the vaccine, the batch number, the lot number, and expiry, manufacturer as well. Also, other information that should be include the document or the information pack. You need to document the information type that was provided to the patient before you obtain consent, their signature to show that they consented to accepting the vaccine, and then other things like of course your signature to show that you gave the vaccine, signature of the recipient or their guardian if their children under the age of 18, and then of course the main card should always have the number of the DSNO, that's the disease surveillance and notification officer in that local government. Currently in Nigeria, we have two vaccine documents that are of international relevance. One is the yellow fever vaccine certificate. The second one is a COVID-19 vaccination certificate. Everyone who receives COVID-19 vaccine at your health facility, you will need to make some records to show that they have received that vaccination, since it's a requirement for entry in many countries right now. In Nigeria, we have three main ways to report adverse events following immunization. One is a yellow form. The second is the Med Safety app, also by the WHO and also used by NAFDAC. And the third is the DHIS2 mobile app. For the yellow form, you will need to provide at least 3 sets of information that makes it usable. The first is there must be an identifiable patient, so you need to insert the information, the name of the patient, and at least either a contact number or an email that NAFDAC can follow up on them with. The second is you must be able to provide your own name and contact address so that NAFDAC can also reach out to you. And then the third is to describe as much as you can or as simple as you can the adverse events suffered by the patient. When you fill the yellow form, you should submit as quickly as possible to the Zonal Pharmacovigilance Center assigned to your geopolitical zone. For the Southwest, that is Lagos University Teaching Hospital. Now, for ease of collation, I'm aware that NAFDAC allows that the ACPN should collate yellow forms at their monthly meetings that can be transmitted from the ACPN to the zonal office. All reports received from ACPN are treated with utmost care and attention. The DHIS2 mobile app reporting system is a bit straightforward. Now, to use a DHIS system, you must already be pre-registered and be given a login username and password. When you enter this, you will be logged into the user system where you can start creating a report. Importantly, for COVID-19 vaccines, you need to click the part that says COVID-19 vaccination registry. It's on that part that you will create information about COVID-19 vaccination, AEFIs. Once you have registered your patient, their names will appear, and then you click to document the AEFI that they have experienced and that you are documenting. The DHIS app allows you to capture the patient's information, capture your information, and submit confidentially. The last option, which is also very, very important, is the Med Safety app. The Med Safety app was created through a program with the WHO, and all reports created in Nigeria are domiciled with NAFDAC. The MedSafety app was created to shorten the time between creating AEFI reports and submitting them to the relevant authorities. The advantage of using the MedSafety app is that when you create reports, you can follow through with them until they are resolved. Also, you get feedback from NAFDAC every time you create an AEFI report. Some of the useful features of the MedSafety app include that you can create and report AFIs specific to your patient. Also, you can monitor. There's a screen where you can see all of the adverse drug reaction events that you have reported, see how much of them NAFDAC has attended to, see what's in process, and see when they are concluded. It also provides you with a monitoring page where recall information, monitoring information are released regularly. Also on the app is a list of medicines that have been approved for use locally by NAFDAC in Nigeria. When you install the MedSafety app, go ahead to create an account, enter an alphanumeric password, and you can log in right away. From the display page you see, you can access several options that I've mentioned earlier on, but including create new reports, view former reports that you have created, and also monitor medicines that NAFDAC has put on their watch list. All AEFIs and ADR reports that are submitted through the MedSafety app will receive an acknowledgement response. After your acknowledgement response, your report is documented in the database with NAFDAC, and you will be able to monitor as issues are resolved, and when there are new signals, you will also get a notification on the app. Now, what are signals? Signals are new or updated information or updated clinical information that shows a particular increase in incidence of side effects or untoward effects that are being experienced by people using that medicine or supplement locally. Signals are important because they are generated both from the volunteered information, clinical reports, and other regulatory activities of NAFDAC. NAFDAC goes through the process of validating a signal and commissioning more reports or more studies about the medicines that you have flagged. So, all of your reports, even the ones you think are not necessary, all of those are pooled together to reach a valid result that NAFDAC uses to continue to make medicine use safer in Nigeria. After every AEFI report is made, there are 3 levels at which they are validated or investigated. The first is at the DSNO level. That's when your district, the disease surveillance and notification officer at your district level or at your local government level verifies that this information is correct or is emanating from someone who can legally do so, approves it, and then it goes to the next level. After it's approved at the local government level, it goes to the state level. After the state board or the state's primary healthcare board takes a decision on that report, it goes to the national level, where both the National Primary Healthcare Development Authority reviews the report, and NAFDAC also takes regulatory action on the report. As a vaccinator, one of the things that should cross your mind is, what are my liabilities and how do I manage my risks? For everyone in Nigeria who's been approved to vaccinate, take for example the national call for pharmacists to participate as vaccinators for the COVID-19 vaccine. That national call and the resulting policies from the National Primary Healthcare Development Authority provides some indemnity for pharmacists. But what are they? And what is covered, what is not covered? As it currently stands, the medical jurisprudence environment in Nigeria is underdeveloped, but at least there are a few things we can take away. We know for a certainty that criminal negligence is the only premise currently for which liability can be placed on a medical vaccinator or placed on a healthcare provider. So, what do you need to do to ensure you reduce your risk both for injury to self and to reduce the risk of injury or loss to your patients? Number one, you as a vaccinator are protected from lawsuits from reasonable vaccination activities. What is reasonable? It is reasonable currently that the NPHCDA has authorized pharmacists to provide COVID-19 vaccination for the general public. It's important that you study that pronouncement so you do not go outside the bounds of that pronouncement. This is because you're only covered to the extent of the policy decision by the NPHCDA. It is also important to follow all the guidelines and the standard operating procedure that will be recommended by the NPHCDA in this vaccination endeavor. Number one, it's important that you remain in good standing. Ensure that your registration with your regulator is up to date. Ensure that you have malpractice insurance and it is up to date. Ensure all the SOPs, like I mentioned, that have been recommended by the NPHCDA are followed to the letter. Do not administer vaccines when you do not have emergency kits available. The National Vaccine Policy recommends 3 steps. Number one, maintain all vaccine records, both locally and the ones you upload to the website, the DHIS. Number two, ensure the training of both yourself and all the staff involved in providing vaccine to the general public. Number three, the National Vaccine Policy recommends that you use the SOPs and guidelines that have been provided by the NPHCDA for all vaccine encounters. If you adhere by all of these recommendations, you would have managed your risks to a low level. You might have heard me say that you're covered with respect to vaccines that have been approved by the NPHCDA for you to administer within your practice. Yes. Now, in lieu of that, there are 2 things that can be done. The first is something called a standing order. Standing orders, or non-patient specific standing orders, are written orders that allow you as a pharmacist to administer all vaccines or routine vaccines to patients when you determine that they need them. Standing orders are a collaborative practice agreement between yourself and someone who can legally provide that vaccination service. For example, a medical provider, a clinic or hospital. Even though they're not currently operational in Nigeria, but we feel that standing orders can become a standard practice that helps us quickly get from the point where pharmacists have become trained vaccinators to the point where pharmacists can legally administer all vaccines to patients when they determine that the patient is in need of that vaccine. The alternative to this is that pharmacists will need to wait until a determination is reached by the NPHCDA to recognize pharmacists as primary healthcare delivery points. A standing order will legally include the target audience to receive the vaccines. It will also include information about the procedure for administering the vaccines, information on contraindication information and precautions for the vaccines. It will also include orders to administer anaphylactic agents to a patient suffering an AEFI. Now, following those SOs or standing orders will be a protocol called the Standing Orders Protocol. The Standing Orders Protocol will need to contain a long list of items. Thus, it will instruct you on how to screen for contraindications, recommend all needed vaccines to patients. It will help you identify how to inform patients of potential adverse events and adverse reactions. It will help you find the way to communicate information about potential side effects and adverse reactions to patients. The protocol also helps you, go step by step to obtain consent, informed consent from the patient. After you've obtained the informed consent, it also helps you walk through the process of, administering the right vaccine through the right route. It will specify the route of administration. If it's a multi-dose or multi-series vaccine, it will tell you what the first dose should be, the duration between that and the next dose, and the duration between that and the final dose. So the protocol is more like an extensive document that instructs the pharmacist on all that they need to do, all of the global things that they need to do to ensure the patient gets the best and also receives appropriate information suitable for their care. Now, there are 10 steps that we're going to discuss next. This helps us implement all of the protocols we've discussed so far. It helps you go from ideating to gaining the confidence of your staff and other staff within your establishment, marketing the vaccine service, getting patients, reaching to the patients, and then obtaining consent, implementing the service, and then the process for your review. The first step is getting the leadership of your facility to buy in to your thoughts. You have well thought about the benefit of your community. Now it's time for your facility leadership, especially when you're not the pharmacist owner, right, to help them get into the same point where you realized that this service is going to be beneficial to both your clients and the overall health of your business. One of the things I believe that if you share with them, they will be able to understand is standing orders are an important intervention to increase uptake of vaccinations, and it has been recommended as an evidence-based intervention by the CDC in the United States. The next step is for you to identify someone to lead this program, especially if you're the pharmacy owner and you do not directly work in the premise. You need to identify a lead who will be as passionate as you are about executing this service. We recommend that you identify someone who's passionate, but also someone who has a lot of influence with the remaining of your staff. The next step is for you to identify those vaccines that are important to administer in your premise. So you need to do a little survey. Find out what are the diseases, vaccine preventable diseases that are on the top of the list or priority for the health, for the Ministry of Health in your state. Find out if these priority diseases that have been taught about by the state are also priority diseases for the patients in your locality. The next step is for you to develop or create documents and policies to guide this action. In Nigeria, the NPHCDA is charged with developing policies for all care at the primary care level, especially vaccination. Now, they have a host of documents that guide vaccine administration in primary healthcare centers across Nigeria. If you can get a hold of one of these, that'd be wonderful. If you can't, then working with your pharmacist who's been credentialed to handle vaccination, you'll be able to develop information that's relevant, contextual, and useful in your practice. Now it's time for you to get buy-in from your staff. If you're the one that's driving this process, it's time to say some talking points. What will you use to convince your staff? Let me quickly list 3 things you can talk to them about. Talk to them about the number or the thousands of people who are dying in your community every year from vaccine preventable deaths. Next thing you want to talk to them about is that standing orders are a standardized way through which your premise can begin to provide a service to the community in such a way that you will not miss opportunities to provide the service and deliver it in a very safe way. Lastly, let them know that vaccines are one of the most cost-effective ways to prevent diseases. The next point of call is to determine an operational strategy. You have already got buy-in of your staff. You need to work with them to design a workflow. At what point do you begin to talk to patients about vaccines or taking vaccines in your premise? Is it when you walk through the door? Is it when they're discussing with the pharmacist on the shop floor? Or is it when they're at the till? This is my advice. When patients get to the till, please provide them a written document that informs them about vaccines and vaccine services in your pharmacy. When they're coming through the door, it may be hassling. When they're at your shelves and looking for a specific product, it may be distracting. But if they're just browsing that day, then that might be an important opportunity to tell them about your vaccine program. If they're already on their way out of the door, then you may have lost that opportunity. But if they have come in and you're speaking with the pharmacist on the shop floor, after consulting with the pharmacist, it's important that the pharmacist should mention your vaccine program to every customer that comes through the door. Barring that, as soon as they get to the till and are closing their purchase, it's important that within those 1 to 3 minutes that they are being closed out at the till, that you provide written information for them. The reason why written information may be better is that with written information, they leave your premise with something that they can reference later. Another good thing with written information, especially when it has pictures and tables, is that they can immediately flip through and identify something that they may need in your premise. That it's also important that when your patients take on vaccines at your premise, it's important that you find a system that documents that and can also provide you a sort of not a warning system, but sort of a reminder, so you can remember to send them reminders as well, especially when you're dealing with multi-dose or multi-series vaccines like the COVID vaccine. The next step is to define the responsibility of your staff and provide them training suitable for that level of responsibility. There should be point staff who are intimating patients about the vaccine service. There should be staff who are or is in charge of creating documentation, and it's important that you as a pharmacist review all of the records regarding vaccination before the patient leaves, so you can certify that all that information is complete. Assign roles to your staff, but be sure that you can supervise every aspect, from informing and screening the patient for your vaccination service. Of course, you are the pharmacist, you are the one who's credentialed to administer the vaccine, so you will be the one to administer the vaccine, ensure emergency response kits are available, and also create the records and be sure that they are properly done before the patient leaves. You may be able to delegate things like submitting records to the local government or the MPHCDA local government office in your area. But of course, you are the one in charge, so you will be the one to administer the vaccines and also document what you've done. The next step is publicizing your vaccination program. You can have several opportunities for doing this. One is when patients present or during patient encounters in your pharmacy. Another one is you can expand the avenues for interaction with the patient by going into the community, sharing flyers, speaking to your neighbors, speaking at church gatherings or mosque events, including outreach events that you specifically create to screen or to provide information to your community. Congratulations! Now that you've started your program, be aware that you need to monitor how well is the program going, how many people compared to the number you targeted at the beginning of your vaccination program. How many people have you covered in the quarter? How many people have you vaccinated in the last 6 months? How many people have you vaccinated in the last 1 year? Are you making a dent? Are you increasing the number of people having access to vaccines through your premise? It's important to also track adherence. For example, for vaccines which have a space of 6 months, how many of your patients have returned after 6 months for their second dose? For vaccines with several sessions, how many of your patients have completed all of their vaccine sessions? It's important for you to track this so you know when it's time to begin to intervene or increase, it's important to track this so that you know your numbers, and if they're bad, know when to intervene or what kind of intervention is required to increase your the adherence and the session completion statistics at your premise. I'm sure you know that several vaccines are multi-dose or multi-series vaccines. Now, for such vaccines, some of your patients find that there are more hurdles to cross, especially when they've taken the first dose and there's some lag time between that first dose and the second dose. This hurdle can be a real hassle for many of your patients. So it's important that you realize, especially when you start, that the number of people you are able to recruit into your program does not signify success just yet. You need to ensure that they complete all of their sessions before you celebrate. Here are a few strategies that you can implement to help you increase adherence and completion rate for vaccines in your pharmacy. Number 1, reduce missed vaccine opportunities. How do you do that? 1, ensure that every contact with the pharmacist in your premise involves a screening for a vaccine opportunity. Secondly, every interaction outside the pharmacy during outreaches, ensure that you incorporate vaccine screening as well. Now, a very important point which has featured in most recommendations is to implement something called a reminder and recall method. Reminders are messages you send to your patients before their appointment to tell them to come in at the appointed or the agreed date. Recalls are those messages that you send when your patient has missed their appointment. It's supposed to help ensure that they complete their vaccine series and do not join the stats about the number of people who have not completed theirs. So it's important that you maintain contact with all your patients who have initiated vaccines, multi-series vaccines, and call them, to remind them when appropriate to come in for their follow-up vaccines. Another thing is to improve patient education. Most times when you work with patients, they may have some questions that are still on the back of their mind, or that they, certain concerns that they have. Sometimes they experience AFIs following their first dose, but that AFI does not preclude them from receiving the next dose. It's important that you educate such patients and help allay their fears so they get their next vaccination. Mandatory requirements also help increase vaccination rates, but it has also been found that sometimes mandatory requirements may not be the best solution for getting people to increase their vaccination rate, because then you find out that people may rush for scarce resources, begin to complain, or begin to forge vaccine documentation. Another intervention that you can implement is home visitation. You can decide to increase the number of vaccine contact points by going to your patient's home and vaccinating them there. Let's talk about marketing. You've created an immunization program for your community. You want to do good to them. You want to do good by them. But then if you blink in the dark, nobody will see you. So how do you get out in the open, contact your patients, and invite them to come in? There are two ways you can do this. Number one, you can provide immunization to existing customers. Number two, you can go out and look for new customers. Which is easier? Of course, provide immunization to existing customers. So let's talk about that quickly. How do you reach existing customers and convince them to take up this new service? Number one, every time customers walk onto your shop floor, you can provide written vaccine information leaflets for them, or have the pharmacist who they encounter speak to them about vaccine service that you render. Another opportunity is when you send out your monthly text messages or weekly health information text to your patients, to your clients. Include information about your vaccine service. Include the benefits of those vaccines and how they work together to improve patients' quality of life. Now, for your patients who have taken their first dose, ensure you implement a reminder system. If you do not implement a reminder system, you will miss the opportunity to remind them and to improve adherence. For patients who are not yet existing in your service, there are several opportunities. One is community outreach projects. Go out into the community, screen people in your community, and you will be able to identify people who need these vaccines but who are not currently part of your clients. You can also implement media outreaches. For example, you can go onto the local radio station in your environment and speak about health promotion activities. Aside from this, there are other marketing tools that you can use. For example, you can bundle services together. If there are people you currently provide travel medicine advisory to, you can also ask them to take vaccine services at your pharmacy. For example, people who are traveling will require COVID-19 vaccines. It's mandatory. You can also promote your vaccine services through social media. Provide beneficial information to people. Sometimes go live on video or using audio services. For example, Facebook has an audio service, Twitter has an audio service. Both of these act like radio, and they will be broadcast to both your contacts and some of the people that are online at the same time. You can also record short video messages about the benefits of vaccination and the number of people who are currently, dying from vaccine preventable deaths in your community. These are all methods to reach people who have not yet been reached in your community and increase your own patronage. We have looked at how you can offer vaccine service to patients who already use your service, or how to reach patients who do not currently use your service. We've talked about various mediums through which you can reach people. We've talked about community outreaches. We've also talked about social media as a tool through which you can reach people. We've also talked about multimedia access. For example, radio, TV may be very expensive, but it's also feasible. There's a more detailed presentation that's attached to this video session. I hope you take the time to go through it. If you need additional resources, please feel free to reach out to me. God bless.